All right, ladies and gentlemen, welcome to the Science of Human Optimization training with Dr. Mitchell Kurk. Dr. Kurk is a board certified medical doctor. He's a doctor of osteopathy, doctor of optometry. He's a world-renowned pioneer in both functional medicine and anti-aging medicine. He specialized in medical nutrition for many, many decades. And not only is he the author of this excellent book, Prescription for Long Life, Essential Remedies for Longevity, he is the embodiment of it. And today we're going to actually discuss clients that we're working with and their individual and unique issues that we want to optimize. So thanks for joining us, and we'll get started. This is an informal meeting, but we're going to have us a good time, I do believe. Great. All right. So I'll ask, we can start with Eileen, if you'd like to introduce yourself real quick.
Hi, my name's Eileen Castaldo. I'm a family nurse practitioner. I've been practicing conventionally since 2004 and have always been interested in alternative medicine and doing some on my own, and wanted to join forces and learn more with other nurse practitioners and doctors. And Alex was had the opportunity, so I joined.
Wonderful. Well, nice to have you. Brittany?
Hey, Dr. Kurk. My name is Brittany Durst. Hi, I remember you from our meeting, I think our first get together. So yes. Good to see you again. Yeah, so I practice here in Illinois at an urgent care currently, but I've been interested in functional medicine for quite some time. Kind of initially got into it myself as a patient when I had our fourth child, my daughter. We have some cancer in our family with my mom, and my brother passed away from lymphoma. And just kind of wanted to make some changes for myself and my kids, and kind of got on that path. And I've seen some really good things in myself that I've really liked, good changes just from, supplementation and diet and whatnot. So I've just really delved into functional medicine, and I'm very excited to have this opportunity with Science of Human Optimization.
Wonderful. Brittany, good to have you. Marissa?
Hi, everyone. My name is Marissa Belanda. I'm a family nurse practitioner. I have a background in oncology, and I really got interested in functional medicine through my husband. He went through a personal struggle that with seeing a functional medicine provider, making a few lifestyle changes, he has ultimately been cured, and I really have a passion, and I want to share that with the world and help others, along with Alex and the Science of Human Optimization.
Awesome. Thank you, Marissa. Rose, welcome. Nice to have you.
Thank you. Hi, everyone. I'm Rose Tarcio. I'm a family nurse practitioner. I have a basically background in family medicine and urgent care. Did a little bit of integrative medicine training at Quantum University, but I put that on hold because I wanted to focus on psychiatry. I worked mainly in underserved communities. And I saw that there was a huge link with mental illnesses and physical illnesses. And I kind of want to combine that to address the root cause and also combine integrative medicine. So I'm really happy to be here, and thank you.
Wonderful. Good to have you. Rose made an introduction video on her approach. It's on our ScHOinc.com page if anybody would like to see it. And Dr. Mitchell Kurk. So nice to have you all. And whatever questions you ladies have. So what happened was, Rose, each one of our practitioners saw a client. And Brittany, did you get the blood work back yet?
Yes, I have it here.
That's so awesome. All right, so we're all set. So what happened was they each saw a client. They were put in through integrative genetic solutions. So they have the results now from that portal with all of the correlation between what the human body needs to function optimally and the person's blood work. So now what we want to do is consult with Dr. Kurk and really figure out how to optimize these people with their vitamins, minerals, toxicity levels, digestive function, all of that kind of stuff. So Dr. Kurk, anything you'd like to say to get us started?
Well, I'm ready to look at the lab reports. I should be glad to give my opinion.
Wonderful. So whoever wants to go first, please.
I can start. So I have my patients, and I just kind of went through and circled her abnormal values. So far, I had some questions about I guess like her homocysteine level was kind of right on the border. So the range they gave us was the 3.7 to 13.9. She was at 14. I know that has to do with like the metabolism of like the B6, B12, and folate, and then plays into like the iron deficiencies and whatnot too. But if that's really high or low, how do you, I guess, address that at first? Like, do you look at all of the other factors there too, or what do you do for that?
Well, if the homocysteine is towards the elevated side, there are supplements that do address that with methylated folate, methylated B12. And as I say, there are supplements from different companies that have those ingredients. So with the you want to address the homocysteine, because if it's too elevated, it's a bad prognostic sign. You should take care of the homocysteine with the vitamin therapy, as I said before, and don't neglect it. We have products called the homocysteine X. It's a certain product. We have other companies that have it with different names, but it is widely available and very easy to treat with these supplements. So I would suggest you do it if the homocysteine is towards the high side.
Okay. All right. And then
I'm sorry, I just have a question.
Yeah.
The homocysteine has to do with coronary issues, so heart attack, heart problems like that, right? That's homocysteine when it's elevated like that, especially that high.
Mhm.
And it's a pretty simple process to get that down with vitamin D and folate. But does it go up because we're deficient in vitamin B complex, or we're just not absorbing it from the food that we're eating because the gut might be compromised? What do you think?
I would think that it is a problem in certain patients. We can't say it's due to a lack of these vitamins, but the vitamins they do treat the homocysteine, but the homocysteine is not caused by lack of these vitamins usually. It's due to metabolic defects. So if there is a metabolic defect showing up by homocysteine, very easy, supplement it with some vitamins. And
okay.
diet, of course, you have to be on a good diet, right? Don't forget the diet is so important. Diet and exercise.
What part of diet can raise homocysteine?
Well, any of the products that have the B complex group in them.
I mean, make it, what the kind of food makes it work?
Fresh vegetables, salads and fresh vegetables and fruits. They all have these products in them, these substances. So a healthy diet is very, very important. And by a healthy diet, I don't mean going to McDonald's. It has to be natural foods, if possible, organic foods. But a lot of fruits, vegetables, you can have meat. Meat is important too. Meat, fish, fowl, fresh vegetables, fresh fruits. A Mediterranean type diet is good, Mediterranean diet. Or Dr. Hoffman's diet is good, the salmon and salmon diet. Or the vegan diet is also good. But as long as it's a healthy diet, which will give you a lot of these necessary supplements. But I would recommend also that you do take some supplements by mouth. Don't rely only on a diet.
Okay. And her B12 was also elevated. Like it was over the 911 mark. She's at 921. Would that be associated with the high homocysteine?
In my experience of 100 patients that we do B12 and folic levels, they're all elevated. So I don't have too much confidence in getting the B12 and folic levels, but they should be done, of course. The homocysteine is more important than the B12 concentration in the blood. Because as I said, if I do a B12 and folic acid in the blood of 90 people, 89 of them would have an elevated B12. I said, what the heck's going on here? So I don't know. I don't place too much emphasis on the blood for B12 or folic acid, but it should be done.
Okay. All right. Sorry, I'm just looking through my notes here real quick. If you guys have other questions too, jump in. You're more than welcome to.
My patient had a high B6 and also a high homocysteine and the high B12 as well.
Yeah.
The high B6 correlated at all?
the most important thing really is to treat the homocysteine. I would treat that. High B6, that may be possible. I don't know of any pathologies caused by elevated B6. I think that decrease of B6 is more important than elevated B6.
Mhm.
But if we do give any vitamins for treatment of with vitamins, I would give the whole B complex group to a patient if they need any particular vitamin of the B complex group. I'll give the entire B complex: B12,
Mhm.
B1, B2, B3, B6, B5, B12. I would give everything complete B complex vitamin, a good one, a good
Mhm.
product, a good name brand, not cheap. You don't want to take anything from China. Speaking of Chinese vitamins and minerals, be very careful in using products from China, because I found over the years that a lot of these things are contaminated. They have a lot of lead in them, and the quality is not as good as the American brand. Be careful with that.
Lee, you had a question?
I wanted to say something in relation to the homocysteine and the B vitamins. From my understanding, the homocysteine can be elevated because the body can't utilize, and that might be why the vitamins are high. The B12, B6, and the folate can't utilize it in the normal form. So you have to take it in the reduced form, like you had started to say, the P5P, the pyridoxine. I can't remember the names of all the methylfolate, the
Yeah,
ones that are already metabolized, because when your homocysteine is high, it could be one of those SNPs where you can't metabolize the B vitamins. So I'm just thinking that might be the paradox of why the vitamins B12, folate, B6 might be high, because they're not being able to utilize
good
it.
thoughts.
You have to get
Right.
those good supplements, those really good supplements.
It is a good thought. Now, if you're going to do the homocysteine on patients, the insurance companies may not want to pay for that. They're going to question you, why you're doing the homocysteine. It's not medically necessary. And this comes to me very often when I order a homocysteine evaluation. So be prepared for that and your experiences with the insurance companies.
Medical necessity is specifically for people that already have a chronic disease. So that's why they're not interested in preventing heart disease. They're not interested in prevention, not because they're mean or bad. They just, this is triage medicine. So when you sever your finger, they, make sure you don't bleed to death. That's all, that's their job. So it's nothing personal, but I think it's an important thing with the heart disease, 650,000 people a year dying from heart disease in the United States. It should be addressed, I think.
I guess too, if you're fixing, you're supplementing to fix the homocysteine with insurance coverage, like how often are you rechecking that homocysteine level, just so they're not getting charged too much?
They may be charged. It may not be covered.
Okay.
It all depends on the different companies. But if the homocysteine is elevated, I would like to see how it is every 3 months for a few times, see if it's responding to treatment.
Okay.
Free.
Rose, please.
I have a question about the homocysteine. If there's a family history of elevated cholesterol, could we use like the family history as the ICD-10 code for it to be covered? Do you know?
I would do that.
Okay.
I would do that because if you do that, it's possible that the companies may decide, well, we'll pay for it this time. We'll do it. Because they put down that they have a dermatitis of the thigh, they're not going to pay for homocysteine. It has to be medically necessary, more or less. And when you mention heart, that could be medically necessary. Good
Okay.
idea.
Thank you.
Are you done, Brittany, or you have more on your abnormals?
You can go ahead. Her abnormals are mostly like a lot of allergies. She really didn't have a lot. She's on a lot of supplements right now. So I was really just kind of confused about the homocysteine. That was my main thing. She has like her hemoglobin A1C it's good, 5.5.
That's okay.
Yeah, I think there was Yeah, postmenopausal, her total testosterone total, she was 7.56, so she was still in normal range, like the normal low. Do you always supplement with like the normal low ranges, or do you just?
Which, what are you talking about? Which one?
She's it's the testosterone total. She's at 7.56, and so it says less than 7 to 45.6 is where she should be normally.
That should be okay for a woman.
Okay. You just don't let it be.
level. If you give, I prescribe testosterone to women for a number of reasons. Number one, they have low libido.
Mm-hmm.
Number two, they want some more strength. They have osteoporosis.
Okay.
And it makes the libido better.
Mm-hmm.
So those three things, we do give some testosterone, usually in a compounded cream for application, made by a compounding pharmacist. You can give the bioidentical hormones in a compounding cream as well, made by a compounding pharmacist. But if you're going to do that, you want to make sure that the female, the woman, has had a mammogram, has had a pelvic examination, usually by gynecologists if possible, and probably a pelvic sonogram as well, to make sure there's no uterine cancer or breast cancer. You can't give these hormones if the person has those malignancies or tendency or family history.
Right. That was another question too. Like, so there's a lot of women that have like personal history of breast, ovarian. What do you typically do to help them with like libido? Is there anything that we can supplement them with that's more natural that you have found?
You have to be careful. Once again, I be very careful with using hormones on patients with malignancies. You could try some black cohosh. Black cohosh is an herb that we have used for women for a low libido. We can do that. You can try some ginseng. Ginseng may help with the libido. Those are the main things really for libido.
Okay.
Okay.
Yeah, you can go ahead. I think that was most of my questions. I'll jump back in.
Okay, I have a number of concerns with my client that I think are serious, potentially serious. One of them is she has a positive ANA and she has a positive Sjogren's antibody, SSB. So she has an autoimmune disease, and she did have a low white blood count on functionally 4.2 rather than above 5. So it kind of goes along with the autoimmunity. So that's one thing. She also had a high aluminum, which I'd like to do something about pretty quickly. And she also has high cholesterol, very high cholesterol, plus a high Lp(a), which is an independent risk factor for cardiac issues. So I do have a number of supplements and ideas for these things. She also has a high homocysteine. Those are my main concerns about her. I have ideas for the Lp(a) and the cholesterol, but the aluminum, other than nutritionally, I'm not sure if she should go on chelation. And also with the autoimmune, I think we need to work on healing her gut. So I have some supplements in mind to heal the gut, some powders, but also wondering if she has some kind of small intestinal bacterial overgrowth or some other pathogenic thing going on in her intestines that's causing this. Wondering if we should look into it a little further. So what are your thoughts on all of that?
She does have some problems.
Yes.
As far as the aluminum goes, once again, we have to make sure we don't use aluminum pots, aluminum foil, which a lot of housewives use. They use aluminum foil. So none of that, no aluminum pots. More aluminum pots. In the old days, they used to have wherever aluminum, wherever. And these people used to come to their house and detail and sell their aluminum pots. And everyone used aluminum pots. And as a result, there's too much aluminum in the system. What to do with the aluminum? You have to eliminate the foil and the pots. And I give them some kind of a product to detox. I like Pectasol, Pectasol detox. Pectasol detox. You take 1-3 times a day. It'll bring down the aluminum. And of course, by staying away from the aluminum foil and pots, that also will help. As far as the elevation of the Sjögren's syndrome and the ANA, in this case, it would be good to refer her to a rheumatologist for an opinion. You have to check the rheumatoid arthritis. Was that done at all? Rheumatoid RA test?
Yeah, it was a positive ANA with a reflex, and the only thing was positive was the Sjögren's.
Yes, well, okay, that's
No
very common.
lupus, there was no RA, nothing else but
Yeah,
that.
that's pretty common. But if I get someone like that, I always refer them to a rheumatologist for an opinion, to see what they say. What to do with the what else does she have? She has the probiotics. Is the woman on a probiotic formula?
She is. She's on a probiotic. She's
You
not
have
on a gut lining healing thing.
It has
so
to be
I
a good probiotic for a major company, not from China.
No, it's a good one.
To check the bowel, we recommend the comprehensive digestive stool analysis, the CDSA. That's from Geneva Labs, Geneva. And it's an excellent group of tests to check for digestive stool. It can tell you if you need any probiotics, if you're digesting, you have enough of the acids in the system to help digest. I would recommend the CDSA. Do that.
CDSA.
You see, comprehensive digestive stool analysis, CDSA from Geneva Labs. I don't have their number offhand.
That's okay. I can look them up.
Yeah.
Do they allow testing in New York State?
They do. The CDSA is approved in New York. Not all of them. You have to put down New York. When you have to get a kit, some kits from Geneva Labs. They'll send them to you, and you tell them it's from New York, and it says on there, New York permitted, New York. Some of them aren't covered, of course, if it doesn't say New York.
Right.
But New York is very, very tough for nutritional testing. We used to use a laboratory for food allergies, which was excellent, wonderful lab, and they couldn't get approval for New York State because it cost a minimum of $100,000 to apply for a license, and probably a lot more. So a lot of the labs are not available anymore in New York.
Right.
What's the other one? The homocysteine. Well, that you have to treat the homocysteine.
Yeah, it was the high LP little a with very high cholesterol. But I have a whole list of things in a combination pack that I can
diet. She needs the diet, right?
Yes, diet. She's good on her diet.
Diet's important. And different Berabine is good. A Berabine formula, Berabine.
Yes.
Yeah, but there are a whole lot of different products for high cholesterol.
Cardio Met Pack from Orthomolecular. I take it myself for my problem. I have the exact same thing.
A very good company, Orthomolecular.
Berberine, and it has omega-3. She was low in omega-3, which helps the LP little a, and proline, a collagen supplement.
Sounds very good. Sounds good. If with fish oils, I started to use not plain fish oils, but krill oil, which is, krill is from upstate Alaska's near there. Krill oil as a supplement for fatty acids rather than plain fish oils. So I give krill oil, say 1,000 milligrams, 2 or 3 times a day. It's an excellent product, krill oil.
Have you heard of skate oil? I just learned of skate oil. That's really good.
Skate oil?
Skate. It's a kind of a fish.
No,
Yeah.
No.
Okay. Yeah. I just learned of it like just the other day.
I'm sure it's good. But krill oil is krill. A lot of the bigger fish in the ocean eat krill. Krill feeds most of the fish, the larger fish. So if it's good for the larger fish, it should be good for us.
Hopefully. Thank you.
Any other questions?
I have another question. I had an elevated bilirubin. It was the upper limit's 1.2. He was 1.3. So not
Is the patient Italian?
No.
Because Italians have a tendency to have elevated bilirubin. It's called Gilbert's syndrome. Gilbert's syndrome, where the bilirubin is elevated. Doesn't mean anything.
Okay.
This one is not. Well, if there's any other symptomatology of gallbladder, liver, anything like that.
No.
Liver function is good. Well, what you might do, you might do a sonogram of the abdomen and the hepatobiliary tree to check the gallbladder, the liver, sonogram, and the liver function testing. Do that.
Okay.
And of course, you want to check for hepatitis A, B, and C. That's kind of common. And patients sometimes have hepatitis A, they don't even know they had it.
Doesn't the blood work we do look at all that or no? It's not that comprehensive.
I believe.
Some of the like liver enzymes, but not all like hepatitis and everything, unless we.
Yeah, it has the liver enzymes, but it doesn't have the hepatitis.
Basic.
But the liver enzymes are high, you should do a hepatitis screen anyway.
Okay. They're not high. They're in the 20s.
Okay.
I have another thing. I did a urine iodine because she had thyroid nodules and thyroid history, so I wanted to check. It was 0. So does that mean she's low in iodine? Should she take an iodine?
Probably. Yeah. You could do a serum blood iodine. You could do that too.
A blood iodine.
Blood iodine.
Wasn't done.
Yeah,
Okay.
serum iodine. And
Which is more accurate.
the number of ways of handling that. If the blood iodine is low, you can supplement it with iodine.
Right. I
Some
think
Lugol's iodine, Lugol's, Lugol's iodine, 1 or 2 drops a day of Lugol's iodine. Iodine is very, very good for the thyroid, and it's anti-cancer too, iodine. They say it's anti-cancer. So that's an important test. But do the serum iodine as well as the urine iodine.
okay.
The other way to do it with the iodine, if you like, you can get some regular tincture of iodine.
What kind?
Tincture of iodine, the old-fashioned iodine.
Iodine. Okay.
They don't even have it anymore practically, so you have to look around for it. And you make a stain on your inner thigh, the stain of the iodine, about the size of a 50-cent piece. And the stain of the iodine should last for 24 hours. If you look at the stain after 6 hours and there's no more stain, that means the body is absorbing the iodine and patients need iodine. So if they absorb the iodine after 6 hours, put more iodine on the other side. And little by little, you go back and forth, the stain will last for 24 hours. That means that they need iodine.
Okay.
How are we doing? You guys have more questions?
One more. I had a high selenium level.
That's good.
Along with a high. That's good.
Yeah.
Okay.
Selenium is a valuable nutrient, and some say that it's good to take a good selenium level if you have cancer. Selenium is anti-cancer. So I think that's okay.
Okay.
Yes, Rose, please.
So I had a question about excessive vitamin levels, as I know some of the cases that were presented had high vitamin B6 and vitamin B12. Are we concerned at all with that, or should we continue with B complex?
B complex is water soluble. Water soluble.
Correct.
So if you have too much in you, usually it gets excreted out in the urine.
Right. But is there ever a case where it's just way too much, even if we
like which one? Which one? The B12 and folic acid? As I said, that's always high. When we check a patient for vitamins, the B12 and folic, they're always high for some reason. So I don't get too excited about that. Once again, it's water soluble, so I can't get too excited. But what you probably should do if you're taking a B complex is reduce it somewhat. Just because it is high, to reduce it. But I wouldn't get too excited.
Okay, thank you.
Well, once we're done with the questions for this part, I just want to talk about longevity as a focus of our efforts. So, any further questions, ladies?
One more, sorry. I did testosterone levels on my patient, and it was the sex hormone binding globulin was high, but not the testosterone total. Does that have any significance?
Well, you do that test with the other hormones, sex hormone, SHGB, sex hormone binding globulin. A lot of the endocrinologists do use that to see how the other hormones are. So you have to make sure testosterone is okay, and make sure the estrogen and progesterone are okay. It's an indication that there is some problem with the hormones. But usually one of the other hormones is low or high if the sex hormone binding globulin is elevated. So just make sure the other hormones are okay.
All the other hormones were in the normal range.
How old is she?
This is actually a male.
Oh, how is his prostate? The PSA.
PSA was normal.
PSA is good to be done. PSA is normal. Okay. Well, you have the reading on it?
0.94.
Okay, that's very good. All right, so that's good. Sex hormone binding globulin. It shows that he's okay.
Okay.
He's doing okay.
Happy for that man.
He's not going to have any erectile dysfunction.
Oh, praise the Lord. Praise the
Kind of a
Lord.
level.
Eileen, we can hear you.
One more question. I'm sorry, I just was going through it again. The C peptide was a little low, 0.65, but all the insulin marker, the A1C was great. So what is that? I mean, I thought it meant that she's not producing enough of her own insulin, but.
That could be. I don't use that particular test. I know it is used by the endocrinologist a lot, C peptide. I don't really use that particular marker. But you have to check the other markers, the 2-hour postprandial blood sugar, the glucose tolerance test. Glucose tolerance test is important to do. 6-hour glucose tolerance. When we do the glucose tolerance test, we do it 6 hours. Excuse me, that's my phone. I think it's going to stop. Hold on, it should stop. Anyway,
everything else was good, so.
yeah. If there's any question about diabetes or anything with hypoglycemia, I like the 6-hour glucose tolerance test with insulin levels. In other words, every hour you check the blood sugar and you check the insulin levels. And you also tell the patient, write down how you feel after 2 hours, after 3 hours. I feel good, I feel terrible. Write it down or bring it into me when we interpret the results. That's an excellent test for hypoglycemia, which is very common. If a patient doesn't feel good, it could be hypoglycemia. Usually they don't feel good about 4 o'clock in the afternoon, because that's when they don't have anything to eat, the blood sugar drops. So I would consider doing that as part of the workup, a 6-hour glucose tolerance, if you suspect any sugar problem.
Okay, thanks.
E-peptides, I can't help. I don't use that one.
Okay.
Brittany, any final? You good?
Oh, good.
All right, great. So let's talk a little bit about longevity. Dr. Kurk, I'd like to ask you, and you don't have to answer, and I don't mean to embarrass you, but would you mind sharing your age?
Well, I'm less than 100. I'm 90. 90.
God bless you. So I think you are the true authority on this whole idea of living long, healthy, vibrant, productive life. You work a full schedule. I mean, I've been to your office, it's always packed solid. And the patients love you, and some of your patients are long living people. Some of the ladies I met there are amazing. They're sharp, they're beautiful, they're in their 90s, they're incredible.
And they're looking for a man.
That's good to know. So can you talk about the top most important aspects of what it takes. I mean, I read your book, and I recommend it to anybody that is into living long, healthy, and circumventing chronic disease. What would you say are the top most important things about longevity? Like we know fasting is good, good sleep is good, exercise is good, weight training is good, stress management is good, but are there specific markers for the body that you look at that you'd like to optimize so people can optimize their genetic potential for longevity?
Well, of course, you have to go by the genetic history. If in your family, if your grandfather and your father and your mother died at age 50, 55, that's a bad sign, because genetically you have this problem of not living too long. However, what to do? You have to eat properly, you have to exercise, you have to avoid stress as much as possible. Avoid that stress. Stress is killing. Like I just heard that Rudolph Giuliani had almost a heart attack. He had to go to the hospital. This was the past few days. Well, he's been under a lot of attack lately with the situation. Our country has too much stress. By the way, ladies, too much stress. We're killing each other with this stress. But stress is killing, so you got to avoid that. What else to do? With diet is important, of course. In the old days, we used to use some Vital, which is a formula put out by Dr. Anna Aslan of Romania. It's an injection that you get it twice a week for youth, supposed to be a youth drug. Whether or not it works is questionable. But she was very, very busy in her clinic in Romania. And the Romanian clinics, the people came from all over the world to get these Vital injections, including the Pope Pius, Charlie Chaplin, and Winston Churchill. So what I did when I was in 1988, I said to myself, I got to go to Romania and see what's going on there. So I went to Romania to meet up with Dr. Aslan, and the clinics are phenomenal. People come from all over for these treatments. It's not as big as it used to be, but that's one aspect of anti-aging. And anti-aging is taking good supplements as well. So it's a combination of things. There's not one individual item that's the most important. Everything is important.
That's excellent. Thank you. What about like markers like PSA we spoke about? So we know that's for prostate. Is it for inflammatory markers? I mean, digestive function. Do you look at things like that when you work with
well, if people get a alternative approach, a holistic approach, we do that. We do the heavy metals, which includes aluminum, lead, mercury, things like that. We do the digestive stool analysis, which checks the flora of the bowel and whether or not you're digesting well, which is important. And we check the blood. So once again, it's a combination of things, what to do. You evaluate everything, but you have one thing I'm telling you guys, stress is awful. That stress can kill you. You have to try to avoid stress. Don't fight with your husband or your wife. Try to work it out. Don't get stress. I've seen patients of mine, they're under so much stress, they get a heart attack. You know, all of a sudden they had a heart attack. Why? Because the stress hormones in the body get wild up, and you know, it affects the heart and the circulatory system. You can't do that. You have to just relax these days as best you can. These are terrible times.
Well, stress management is definitely an art. Can we talk a little bit about stress management? You guys meditate, do yoga? Like what's your approach? Rose?
Yes. So I exercise every single day, and I do cardiovascular exercise, weightlifting, yoga, meditation. I'm even training in the Heart Math Institute to kind of like rewire the brain with the patients. And I'm trying it on myself, and it's been really helpful with the heart rate variability. That's what I'm doing.
Awesome.
Mm-hmm.
Marissa?
I love to exercise. It's my first thing that I do in the morning. And like, I think it sets me up for success, as lame as that can sound, but it puts you in a good mood. It helps you start your day. And then also something that I recently started is acupuncture. And I think it's life-changing. So I highly, highly recommend it.
Huh. Acupuncture. I've tried that a few times actually by some of the top professionals. Excellent. Brittany?
I used to be a big runner, and that was kind of my outlet. I don't know if things changed when I had kids, but powerlifting is phenomenal for me. It gets a lot of stress out for me, and it's a good outlet. My husband and I like to work out together, so that's kind of our like connection and de-stress. That's been really nice. And then we have a friend that is a massage therapist, so we try to do that like once a month for just muscle therapy and then brain, mental health too, relaxation. So those are big things for me.
Awesome. Eileen?
I'd like to say I exercise every day, but I really don't do enough. I do a short yoga in the morning. I try and actually get out there, like I had said in my talk, with my feet on the grass and my face towards the sun, and I do a little sun salute exercise every morning. I try and walk a few times a week. I just really don't take enough time to exercise, to tell you the truth. I do some meditation. I'm learning some breathing exercises. And the heart math, Rose, is that with Dr. Joe Dispenza? Is that who that is?
Oh, it's a different provider that does it in California. I can send you the link if you'd like.
Okay, thanks, because I've
You're
heard
welcome.
of that. But then I also just came across a breathing meditation that Dr. Joe Dispenza did, and I felt like amazing after it. So I'm increasing my meditation and exercise program. I'm trying to improve it. It's not regular enough.
Wonderful. Well, so our goal here is to really get to know the people we're working with, develop friendships and relationships with these people. And I think one of the ways we can do that is, I think mindset plays a tremendous part in how people will ultimately behave. And unfortunately, we're up against a $60 billion budget, annual budget from the medical industry that trains people how they should behave, what they should eat, what kind of therapies they should go for. And I think if we can encourage people and educate them why vitamin D is important, for example, and remind them on a regular basis on that, based on the blood work and based on the information that we collect for them, so we know specifically what to talk to them about. If we know that somebody has high aluminum, we want to remind them once a week, so some kind of reminder once a week, maybe like Monday morning, your aluminum levels are high, just remember to get aluminum out of your life. Or, your body is your most important, most valuable possession. Let's make this week a focus on exercise, meditation, and reducing stress, that kind of stuff. So, I think as we develop a relationship, we become more effective in influencing people to take the proper action. So, for example, I notoriously, for a long, long time, no matter who talked to me, my wife, my mother, my friends, about getting a colonoscopy, I was totally, completely against it. But fortunately, I have a practitioner that works with me, who's amazing. And she encouraged me to do a colonoscopy, and I had one done, yesterday. So, yeah, I'm a hero amongst men. I put it up on Facebook. Everybody got so excited. We got so much people, and a bunch of people around me also. It's funny but a lot of people around me also went and booked theirs. So we don't know like the ripple effect of the impact we make on people's lives when we address things like that. And, my brother passed away, my younger brother passed away from colon cancer in February. So I wish he had somebody like that in his life that could have guided him in the proper direction. So I think it will be crucially important to develop these relationships and educate the clients that we work with on what is actually specifically important for them in their life to achieve optimization, to achieve longevity, to circumvent chronic illness, and to live a long, healthy, and productive life. All right. Well, let's see. Any final thoughts? Any final ideas?
I just want to give you one tip, which I learned from a very prominent psychiatrist who uses nutrition. The use of inositol powder. Inositol is one of the B complex. Inositol powder inisitol, inositol powder, a tablespoon 3 times a day for patients who have some psychiatric problems. Now, we're not going to start treating patients. We're not psychiatrists, but it's not a bad idea if someone comes in, their son is all upset and carrying on. Well, why don't you try this inositol powder, see how it works. A tablespoon 3 times a day. And I've seen it work a lot of times. So I just want to pass that on to you. Of course, they also need a psychiatrist to take care of them, but it's not a bad idea if you can try it on, see how they feel with it. And this is all powder.
Awesome. Thank you, Dr. Kurk. So a couple of thoughts, parting thoughts I'd like to share. First of all, how often do you guys think we want to do this? Like, how often do we want to get together, bring a practitioner here and do this kind of a discussion? Once a month, once a quarter, like how often? So really up to you. I'll work around what works for you.
I don't know how often, but I think if a provider would present like a case that he had, like, I had this patient with really bad rheumatoid arthritis. This was her symptoms. This was her lab work. This is what I did for her. Something like that, I think, would be really helpful.
Okay, I mean, if that's what you like. I thought, like,
just an idea.
Yeah, I thought we would like take who we're working with and discuss specifically those things that you're dealing with right now. I mean, we can certainly ask the physician to discuss a client or a current interesting case or whatever, whatever you guys say. So that's fine. The other thing the other thought I had is, maybe every once in a while we can find an interesting case that we can brainstorm together as like it'll be like a show, where somebody's dealing with a really difficult, complicated problem, and we'll invite them on to share the problem, and then we'll all brainstorm what might be the best approach for them. I think it'll be a helpful thing to this individual person, but also it'll give us a platform from where we can kind of share what we're doing and how we're helping people. What would you guys think about that?
Yeah, and I was also thinking, like, after, like you're saying, to recheck, Dr. Kurk, the blood work in 3 months, maybe we could have another meeting after that, after we put our patients on their regimens, and then redo their blood work and see, like, check back in 3 months and say, okay, what worked, what didn't work, and kind of present each other our cases. Maybe. Sound good?
Wonderful.
Yeah, that would be nice.
Okay.
Brittany, did you say something?
Oh, sorry. I just said, yeah, that would be nice to recheck after the 3 months, maybe kind of have a check-in to see.
Okay, great. And finally, I just want to ask you if once we identify a client and we put them, they watch the video, I talk to them, we had them fill out a form, and I forward that information to you. It's really up to you to find this person and set up the first interview. So, we need to be more proactive about that and make sure we find this person and we talk to them. And then after that, it's up to them what they want to do. But, we need to get them in front of us after that, just so that they can get to know us a little bit, because they're not going to do it. And so we need to get more proactive in that. So anyway, we're doing great. I have a company that I'm going to introduce you to in the near future. Really, I was telling Dr. Kurk about it. Really amazing. It's a transdermal supplement line. They've been testing it on athletes, and they have one for the brain that you put on the brain stem right there in the back of the head. And the multi-supplement, you put it on your body around the organs, and it absorbs through the skin, and like 95% absorption rate versus oral supplement that goes through the stomach and all that. So really interesting company. So I think as we're bringing this together, we have some innovative things. We have innovative testing, we have innovative supplements, we have an innovative model of how we're going to be delivering this kind of care, and we have some really remarkable, brilliant, and fabulous practitioners doing it. So on that note, well, thank you all for being a part of this. Dr. Kurk, thank you so much. You're amazing.
Thank you.
Thank you, Dr. Kirk.
Thank you, ladies.
I guess have a great Friday, great weekend, and we'll see you next time. Ciao.
Bye-bye.